Hi, my name's Carlyle. I'll be your nurse today for your appointment. So I'm going to make sure I have all the equipment I need. I have my stethoscope, my pen light, gloves, and then I'm going to perform infection control by cleaning my stethoscope and then by washing my hands. Alright, so first to start off, do you use any assistive devices?
I do not.
Okay. And then if you feel any pain or discomfort during the interview, please let me know.
Okay.
So I'm going to ask you a few questions. Can you tell me your name?
Ryan.
And where you are?
Tamerlane.
And the day?
Sunday.
So patient is alert and oriented ×3. Speech was clear, not slurred. Level of consciousness was appropriate and able to respond to questions. And so I'm going to ask you to remember 3 words to recall later. So they are summer, horse, apple.
Apple.
Okay? And so now if you could smile, frown, puff out your cheeks, and raise your eyebrows. So patient cranial nerves are intact and able to respond to commands. And if you could touch your fingers to your thumb. All right, so patient was able to follow command and fine motor skills were intact. And then if you can close your eyes and I'll touch somewhere on your body, and if you could just let me know where it is.
Left foot, right arm, left cheek, right leg, left hand.
Great, you can open your eyes. So patient sensation is intact. He was able to tell me on the upper and lower extremities and the face where I had touched. And so now you can stand up and I will assess your gait. So if you could walk to the end of the room and come back. All right, so patient gait was normal. There was no swaying or limping and no abnormal balance or coordination. So now if you could balance on one foot and the other foot. Okay, and then close your eyes and put your arms out. All right, so patient coordination and balance was intact. And then if you could turn around and I'll assess your spine. So dive down like you're going into a pool. Okay. All right, so there's no curvature of the spine, signs of scoliosis, kyphosis, lordosis, no palpable lesions or masses. And then, so now, let's see, and posture was erect as well. So I'll test for some range of motion in the upper extremities. So if you could do a big circle with your arm. All right, no signs of crepitus. And bend your elbow. All right, no signs of crepitus in the elbow. Any joint pain?
No.
Okay, and turn your wrist. No crepitus of the left wrist. Same with this side, so arm in a big circle. All right, no crepitus of the upper arm. Bend your elbow. Okay, and your wrist. Great. All right, and then, so skin of the upper extremity is pink, warm, dry to the touch. And I'll also look at your hands. So palpate the fingers and do skin trigger. So no tensing of the skin, adequate hydration, no clubbing of the fingers. Capillary refill is under 3 seconds. Same with this. So palpate the fingers, skin trigger, no tenting of the skin, which means adequate hydration. Capillary refill is under 3 seconds. And I'll feel for your radial pulses. Okay, so pulses were present bilaterally, no abnormal rates or rhythms, 2+ in strength. And then I'll test for some lower extremity range of motion. All right, if you could move your left leg forward and back. No crepitus in the left upper leg or in the knee. I'll test this side. Okay, same thing. No crepitus in the leg. Any joint pain?
No.
All right, and no crepitus of the right knee. All right, so now I'll have you sit back down. Okay, so I will assess the head now and the neck. So head is appropriately placed on the body. It's a good shape and size for the body. Skin appears pink with no visible lesions. Put gloves on for infection control while I palpate the scalp. Okay, so upon palpation of the scalp, hair is evenly distributed, of good texture and color, no signs of critters, no palpable masses on the head. Wash my hands. All right, and so the neck is erect and midline. Trachea is midline. I'll feel the throat. Can you swallow? Okay, so patient swallowing was intact. The thyroid was not palpable, so no goiter. And then I'll palpate for the sinuses and lymph nodes. So let me know if you feel any pressure. Any pressure with that?
No.
Okay, so frontal and maxillary sinuses, no pressure was reported, and no hardening or palpable lymph nodes, which would be a sign of infection. And I'll have you raise your shoulder. Okay, so spinal accessory nerve was intact, and I'll test for TMJ, so if you could open your mouth. Okay, no crepitus was present, no TMJ. And do some range of motion for the neck. So chin forward and back, left, right. So range of motion of the neck was good, and patient reported no pain. So now I will assess the ears. All right, so I'll palpate the ears. There's no visible lesions or rashes. Palpation, there were no palpable nodules, and then I will assess for drainage. Okay, no drainage of the ears. The ears are symmetrical and size and shape and placed appropriately on the head, and I'll whisper a word in each ear if you could just recall it.
Pillow. Phone.
Patient was able to pass the whisper test and recall the words. No difficulty with hearing. Okay, so now I will assess the eyes. So the sclera is white, no signs of jaundice. The eyebrow hair and eyelash hair is appropriate. No edema of the eyelids. The cornea is clear. The iris is green and round. Pupil is 4 millimeters, and the eyes are symmetrical in size and shape. And I'll check the conjunctiva. Okay, so conjunctiva in both eyes are pink, no discharge. And then if you could follow my finger. All right, so patient passed the cardinal field of vision test. Nerves were intact. And I'll test your peripheral vision, so let me know when you see my finger. Yeah. Patient's peripheral vision was intact. And I'll test your pupils. Okay, so pupils were equally round, reactive to light. And then accommodation test, follow the pen. Okay, so pupils were concentric and constricted bilaterally and accommodated. And so now the nose is appropriate size for the face, and no visible surface abnormalities on the face. And do you have any difficulty smelling?
I do not.
Patient reports no difficulty with smelling. And if you could close one nostril, breathe in, the other one. Okay, so nostrils were patent bilaterally. I'll just take a look. So no deviated septum was present. And now I'll assess the mouth. So lips are pink and moist, and mouth is appropriate size and shape for the body. If you could go Okay, so uvula is midline, tonsils were intact, mucosal membranes were pink, hydrated, no signs of cyanosis. The teeth were healthy, no plaque present. The tongue was pink and of good size and shape, and no deviation. Could you stick out your tongue? Okay. So again, tongue didn't deviate to any side, and no odor was present. All right. So skin of the face was warm, dry, and pink. All right. So now, let's see, I'll palpate the precordium. Okay, so there's no palpable flutters or any signs of heaving or difficulty with breathing. And now I'll listen for your heart sounds. All right, so heart sounds, no abnormal rate or rhythm, no whooshing sounds, S1 and S2 were present, and that means mitral and tricuspid valves were functioning properly. And I'll also feel for your carotid. Okay. Carotid pulses were equal strength bilaterally. I'll auscultate them. Okay, so carotid pulses were 2+ bilateral, no bruits or whooshing sounds. And okay, so now, do you mind if I have you stand up and I'll check for lung expansion? So deep breath. Okay, so patient was able to inspire without any difficulty. There's no barreling of the chest, and lungs inflated bilaterally, symmetrically. And now you can sit down and I'll listen for your lung sounds. Deep breath. All right, lung sounds were present, equal bilaterally, and there was no signs of bronchi, wheezing, or crackles. Do you remember the 3 words I asked you to remember?
Summer, horse, and apple.
Great, so patient's short-term memory is intact, able to recall the 3 words. And so now if you would lay down and with your knees bent, and I will assess abdominal sounds. Do you mind if I lift your shirt?
No.
Okay. And vascular sounds as well. So I'll listen to all 4 quadrants for vowel sound. All right, so vowel sounds were present in all 4 quadrants. They were not hypo or hyperactive. Also, I auscultated and did not hear any signs of aortic aneurysm? And then, do you mind if I palpate?
Nope.
And let me know if you feel any pain. Any pain?
No.
Patient reported no pain with palpation of the abdomen. Skin was warm, dry, no palpable masses or lesions. And then I'll finish with the range of motion lower extremities. So do you mind ankles in a circle? Okay, no crepitus of the ankles, spread your toes. Okay, and then skin turgor. There was no tenting of either foot and no clubbing of the toes. Nails are intact. Capillary refill was under 3 seconds. And then I'll feel for posterior tibialis pulse. So both pulses are present bilaterally, 2 plus, equal strength, no abnormal rates or rhythms. And then the plantar dorsalis pulse, equal bilaterally, 2 plus. And the skin and the lower extremities was warm, pink, dry, no visible lesions or rashes. And I think that's it. Thank you.
Thank you.
You know what? I actually forgot to do strength of the lower extremity.
Did you?
I think so. So I'll just have you push up, down. Same with this side. Push up, down. Okay, so strength of lower extremities was 5 out of 5 on both sides. And then on the arms, so push up, down, and this side, up, push down, and then grab. Okay, so strength of upper extremities was 5 out of 5 as well.